Hypoxia is defined as inadequate oxygen availability at the tissue level, leading to decrease in oxidative phosphorylation and ATP production, which leads to cellular dysfunction. The normal oxygen transport depends on alveolar ventilation, hemoglobin concentration, diffusion capacity, and cardiac output. Hypoxia is divided into 4 types: hypoxic hypoxia, anemic hypoxia, stagnant hypoxia, and histotoxic hypoxia. In hypoxic hypoxia, there is decrease in the partial pressure of oxygen in the arterial blood, leading to decreased delivery to the tissue. This is seen in the conditions such as high altitude, COPD, and asthma. Coming to anemic hypoxia, it is due to inadequate hemoglobin to carry oxygen. There is normal partial pressure of oxygen, but decrease in total oxygen transported. This may be seen in conditions such as iron deficiency anemia, hemorrhage, and carbon monoxide poisoning. Coming to stagnant hypoxia, this is when there's a decrease in blood flow or decrease in the cardiac output. This leads to stagnation of the blood. This is seen in the conditions such as heart failure and shock. Next, histotoxic hypoxia. This is when tissue cannot utilize the oxygen. There is blockage in the mitochondrial enzyme leading to stop in oxidative phosphorylation. This is seen in the conditions such as cyanide poisoning. Now, in anemic hypoxia, we have a special case about carbon monoxide poisoning. That is, increase in inhalation of carbon monoxide. Carbon monoxide have 200 times more affinity than that of the oxygen to bind to hemoglobin. So when carbon monoxide binds to hemoglobin, it forms carboxyhemoglobin. And the effects of carboxyhemoglobin are decrease in oxygen capacity, decrease in 2,3-DPG, and left shift of the oxygen dissociation curve. And these effects will cause severe tissue hypoxia. Next, coming to the effects of hypoxia on different systems. Starting with CNS. In CNS, these CNS symptoms are first to appear, and they are headache, dizziness, confusion, and coma. In CVS, we have increased heart rate, increased cardiac output, increased BP, myocardial hypoxia, increased contractility. And in ECG, we see the changes of ST depression and T-wave inversion. In RS, we have increased rate and depth of the respiration, pulmonary constriction. In blood, there is increase in 2,3-DPG, which leads to right shift of the oxygen dissociation curve. There is increase in RBC production and increase in the hemoglobin. Coming to kidney, there is decrease in the renal blood flow, decrease in GFR, and kidney helps in production of erythropoietin, which helps in increased production of RBC. Coming to GI, there is decreased motility, decreased secretion, and there may be stress ulcers form. In muscles, there is decreased ATP, early fatigue can be seen, and cramps. In fetus, there is intrauterine growth retardation, low birth weight, and developmental defects seen. Compensation in hypoxia, the compensation may be seen by hyperventilation, increase in 2,3-DPG, polycythemia, and increased erythropoietin production. Then talking about oxygen therapy is very useful in hypoxic hypoxia, whereas it is not at all useful in histotoxic hypoxia. Save this reel, follow to my channel, and comment hypoxia. I'll DM you the notes.